Why did you choose to pursue a career in mental health nursing?
I chose to pursue a career in mental health nursing because I have always been deeply passionate about supporting individuals facing psychological challenges. From an early age, I recognized the profound impact mental health has on overall well-being, and I wanted to be in a profession that makes a meaningful difference in people's lives. During my clinical training, I was particularly drawn to mental health because it not only requires a strong foundation in medical knowledge but also demands empathy, patience, and the ability to build trusting relationships with patients. What excites me most about this field is the opportunity to work holistically, addressing not just the symptoms but the underlying factors affecting mental health, whether they be social, emotional, or environmental. I find it fulfilling to empower patients, helping them regain their confidence and ability to lead fulfilling lives. Furthermore, mental health nursing allows me to advocate for those who often face stigma, and I take pride in contributing to a more inclusive and understanding society. This career aligns perfectly with my values, offering me the chance to grow both personally and professionally while making a lasting impact on others.
What do you consider to be the most important qualities of a successful mental health nurse?
I chose to pursue a career in mental health nursing because I have always been deeply passionate about supporting individuals facing psychological challenges. From an early age, I recognized the profound impact mental health has on overall well-being, and I wanted to be in a profession that makes a meaningful difference in people's lives. During my clinical training, I was particularly drawn to mental health because it not only requires a strong foundation in medical knowledge but also demands empathy, patience, and the ability to build trusting relationships with patients. What excites me most about this field is the opportunity to work holistically, addressing not just the symptoms but the underlying factors affecting mental health, whether they be social, emotional, or environmental. I find it fulfilling to empower patients, helping them regain their confidence and ability to lead fulfilling lives. Furthermore, mental health nursing allows me to advocate for those who often face stigma, and I take pride in contributing to a more inclusive and understanding society. This career aligns perfectly with my values, offering me the chance to grow both personally and professionally while making a lasting impact on others.
How do you approach building rapport with patients who may be experiencing severe mental health symptoms?
Building rapport with patients experiencing severe mental health symptoms requires patience, empathy, and a non-judgmental approach. My first priority is to create a safe and supportive environment where the patient feels valued and understood. I do this by actively listening, maintaining a calm demeanor, and showing genuine interest in their thoughts and feelings, even when communication might be challenging due to the severity of their symptoms. I approach each patient with respect and without preconceived judgments, recognizing that their symptoms may impact how they interact or trust others. Establishing trust often begins with small, consistent gestures, such as honoring their preferences where possible, respecting boundaries, and ensuring they feel in control of their care. I also use clear and compassionate communication, tailoring my approach to their current emotional state and avoiding overly clinical language that might feel impersonal. Building rapport also involves showing patience and allowing the relationship to develop at the patient's pace. For example, I avoid rushing conversations or pushing them to open up before they are ready. When appropriate, I integrate elements of shared decision-making to help empower the patient, fostering a sense of agency and collaboration in their treatment. Ultimately, my goal is to let the patient know they are not alone, and I am there to support them in their journey toward recovery.
Describe a situation where you had to de-escalate an agitated patient. What strategies did you use?
In one instance during my clinical practice, I encountered a patient who became highly agitated and verbally aggressive due to frustration with their treatment plan. The situation escalated when the patient felt they were not being heard. Recognizing the need to de-escalate quickly while ensuring safety, I first maintained a calm and composed demeanor, which is crucial in preventing the situation from escalating further. I used active listening to validate their emotions, saying something like, "I can see that you're feeling upset, and I want to understand what's troubling you so we can work through it together." This approach helped convey empathy and diffused some of the tension by showing the patient that their concerns were important. I also maintained an open and non-threatening posture, keeping a comfortable distance to ensure they didn't feel cornered. After acknowledging their feelings, I encouraged the patient to express their frustrations fully without interruption, ensuring they felt heard. Once they calmed down slightly, I gently guided the conversation toward problem solving, asking, "What do you think would help improve this situation?" This allowed the patient to regain a sense of control and involvement in their care. Throughout the interaction, I was mindful of my tone, body language, and the environment, ensuring it remained calm and non-confrontational. By the end of the discussion, the patient was noticeably calmer, and we were able to collaboratively adjust the treatment plan to address their concerns. This experience reinforced the importance of patience, empathy, and effective communication in managing challenging situations in mental health care.
How do you balance the needs of multiple patients with varying levels of acuity?
Balancing the needs of multiple patients with varying levels of acuity requires strong prioritization, effective time management, and clear communication. I begin by assessing the acuity of each patient's condition to identify those requiring immediate attention, such as individuals in crisis or those with acute symptoms that could escalate without timely intervention. Safety is always my top priority, so I focus on stabilizing high acuity patients first while ensuring that lower acuity patients are not neglected. I utilize a structured approach, such as creating a mental or written plan at the start of my shift, to allocate time and resources effectively. Delegation is also critical in a team setting. I collaborate with colleagues, assigning tasks or seeking support as needed to ensure that all patients receive appropriate care. At the same time, I remain flexible, adjusting my priorities as new information or situations arise. Communication plays a key role in maintaining this balance. I ensure that patients understand my plan and let them know that while I may need to step away, their needs are important and will be addressed promptly. This transparency helps manage expectations and builds trust. In addition, I utilize every opportunity to provide meaningful interactions, even during brief encounters, ensuring that each patient feels acknowledged and supported. By staying organized, calm, and patient-centered, I can deliver comprehensive care to all patients, regardless of their acuity level.
What are the ethical considerations in mental health nursing, particularly regarding patient confidentiality and autonomy?
Ethical considerations in mental health nursing are critical to providing respectful, patient-centered care, with confidentiality and autonomy being two of the most important principles. Maintaining patient confidentiality is essential to building trust, as patients need to feel safe sharing sensitive and personal information. As a mental health nurse, I am bound by ethical and legal obligations to safeguard this information, disclosing it only when required by law or when there is a clear and immediate risk to the patient or others. For example, if a patient expresses intent to harm themselves or others, I must carefully balance confidentiality with the duty to protect. In such cases, I ensure the disclosure is limited to the necessary information and communicate with transparency whenever possible. Patient autonomy is equally vital, as it respects individuals' rights to make decisions about their own care. This is particularly significant in mental health nursing, where patients may sometimes face stigma or a lack of understanding about their conditions. I strive to involve patients in their treatment plans, providing them with clear, unbiased information so they can make informed choices. Even when a patient's capacity to make decisions is compromised, I advocate for their preferences and involve them in decision-making to the greatest extent possible. Balancing these principles can be challenging, especially when a patient's autonomy conflicts with safety concerns. In such situations, I rely on ethical guidelines, seek input from multidisciplinary teams, and communicate openly with the patient to reach the best possible outcome. Ultimately, my goal is to ensure that care is delivered with dignity, respect, and adherence to ethical standards.
How do you ensure patient safety while respecting their rights and dignity?
Ensuring patient safety while respecting their rights and dignity is a fundamental aspect of mental health nursing and requires a thoughtful, balanced approach. First, I prioritize creating a safe environment where patients feel secure, both physically and emotionally. This involves maintaining a clear awareness of potential risks, such as self-harm, aggression, or environmental hazards, and taking proactive measures to minimize these risks without being overly restrictive or intrusive. At the same time, I uphold patients' rights and dignity by treating them with respect and involving them in their care decisions. I ensure they understand the reasons behind any safety measures, such as the use of observation or crisis intervention plans, and I seek their input whenever possible. For instance, if a patient requires a safety intervention, I explain the rationale behind it in a compassionate and non-judgmental way, fostering collaboration and trust. I also advocate for patients' autonomy by encouraging them to participate actively in their treatment, providing them with choices and respecting their preferences whenever it is safe and appropriate to do so. Maintaining privacy during assessments, addressing patients by their preferred names, and using inclusive, non-stigmatizing language are additional ways I ensure their dignity is preserved. Regular reflection and collaboration with the multidisciplinary team help me strike the right balance between safety and dignity, especially in complex situations. By consistently demonstrating empathy, clear communication, and professionalism, I aim to create a therapeutic environment where patients feel valued and supported while their safety is maintained.
How do you collaborate with other healthcare professionals, such as psychiatrists and social workers, to provide comprehensive care for patients?
Collaboration with other healthcare professionals, such as psychiatrists, social workers, psychologists, and occupational therapists, is essential in providing comprehensive care for patients in mental health settings. Effective teamwork begins with clear and open communication, ensuring that all members of the multidisciplinary team are aligned on the patient's goals and care plan. I actively participate in case discussions, team meetings, and care reviews to share observations and insights from my interactions with patients, which can inform treatment strategies and adjustments. I also value the unique expertise that each team member brings to patient care. For example, while psychiatrists focus on diagnosis and medication management, social workers provide valuable support in addressing social determinants of health, such as housing or family dynamics. By respecting these roles and working collaboratively, we create holistic care plans that address the patient's medical, psychological, and social needs. When collaborating, I ensure that the patient remains at the center of care. I advocate for their preferences and ensure their voice is included in decision-making processes. Additionally, I act as a liaison between patients and other professionals, helping to bridge communication gaps and clarify treatment goals to promote understanding and trust. Flexibility and adaptability are key in interdisciplinary collaboration. I remain open to feedback and willing to adjust my approach based on the team's collective input. This coordinated effort ensures that patients receive seamless, well-rounded care tailored to their unique circumstances and recovery goals.
How do you handle conflict within a team?
Handling conflict within a team requires effective communication, emotional intelligence, and a collaborative mindset. When conflicts arise, I approach the situation with a calm and open attitude, seeking to understand the perspectives of all parties involved. My first step is to listen actively and objectively, ensuring that everyone feels heard and respected. I avoid making assumptions or taking sides, as maintaining neutrality is crucial in resolving disagreements constructively. I focus on identifying the root cause of the conflict rather than dwelling on personal differences. This often involves reframing the issue as a shared challenge that the team can solve together, rather than a divisive problem. I encourage open dialogue, where team members can express their concerns in a professional and respectful manner. If needed, I facilitate discussions to keep the conversation focused on finding solutions rather than assigning blame. In situations where the conflict cannot be resolved immediately, I emphasize the importance of maintaining professionalism and continuing to prioritize patient care. If the issue persists or escalates, I am not hesitant to involve a supervisor or mediator to ensure that the matter is addressed fairly and effectively. Ultimately, I see conflict as an opportunity for growth and collaboration. By addressing it constructively, the team can strengthen its communication and cohesion, which benefits both the team dynamic and the quality of care we provide to patients.
How do you manage stress and burnout in a demanding role like mental health nursing?
Managing stress and preventing burnout in mental health nursing is essential for maintaining my well-being and delivering quality care to patients. I prioritize self-care and adopt strategies that help me stay resilient and balanced in this demanding role. One of my key approaches is maintaining a clear boundary between work and personal life. After a shift, I engage in activities that help me unwind, such as exercise, meditation, or spending time with family and friends. These practices allow me to recharge and separate myself from the emotional intensity of work. At work, I focus on time management and delegation to ensure that my responsibilities are manageable. I also practice mindfulness during challenging moments, which helps me remain calm and centered under pressure. Reflecting on my experiences, either through journaling or supervision, allows me to process my emotions and identify areas for improvement without becoming overwhelmed. Seeking support from colleagues and supervisors is another vital aspect of my stress management. Mental health nursing often involves working within a team, and I find that discussing challenges, sharing insights, and celebrating successes together fosters a sense of camaraderie and reduces feelings of isolation. If I notice signs of burnout, such as emotional exhaustion or detachment, I take proactive steps to address it by adjusting my workload, seeking professional support if necessary, and prioritizing my mental health. I also remind myself of the purpose behind my work, focusing on the positive impact I have on patients' lives. This sense of fulfillment and meaning motivates me to navigate the demands of the role while maintaining my own well-being.